Good morning and welcome to WEV's webinar on mobile health, how to successfully execute your roadmap and manage your requirements. Mr. Karthik Srinivasan is a recognized industry expert with extensive experience in the areas of program management, IT transformation, infrastructure modernization, and systems development methodologies. Mr. Srinivasan manages WEV's solutions development and innovation of emerging IT markets in cybersecurity, mobile computing, cloud computing, big data, and agile practices. He has various experiences in information security practice areas of information assurance, FISMA, certification and accreditation, and cybersecurity policies and growing cyber needs. He has managed several large-scale programs for IT modernization and transformation across DHS, such as ICE and USCIS. During this session, your microphone will be muted. Please type in all questions in the comment section, and we will answer them at the end. Welcome, Karthik.
Good morning, everyone. Today we're going to be talking about mobile health. What exactly is mobile health? M-health or mobile health is the term used for the practice of medicine and public health, supported by mobile devices, such as your iPad, iPhones, or any of the smartphones that are out there. New developments are coming fast and furious when it comes to health IT and its impact on clinical practice. The federal government has focused on a national health IT safety plan, and innovative healthcare delivery organizations are utilizing mobile health strategies for patient engagement, care coordination, and more. Medical adherence remains a prevalent problem, but technology and data can be leveraged to influence patient behavior, so they better manage their health. This was from one of the Telehealth World Congress in 2013, and in today's discussion, we're going to be talking specifically on mobile health. And if you are already working on a roadmap or have a roadmap, how do you successfully execute your roadmap? What are some of the factors to consider? What are some of the challenges that are out there in executing a successful mobile health strategy? And how do you go about managing your requirements is what we're going to be covering in today's discussion. According to a new study from Transparency Market Research, the global mobile health market is expected to reach about $10.2 billion by 2018. That is up from mere $1.3 billion in 2012, almost growing at a CAGR, compound annual growth rate of about 41.5% from 2012 to 2018. And why is that tremendous growth? Here is another data for you. 52% of the smartphones users gather health-related information on their phones, according to one of the infographics and studies from Great Call. And about top 10 mobile health apps generate up to 4 million free and about 300,000 paid downloads each day. You know how many mobile apps are out there related to health and fitness? 97,000 apps, mobile apps out there for mobile health and fitness. And by 2017, almost half of the smartphone users will have downloaded mobile health apps. And that's, a very, very, increasing number, and that kind of substantiates the 42% compound annual growth between now and 2017, growing the mobile health market to about $10.2 billion in 2018. Some of the mobility trends, in healthcare. 85% of hospitals are embracing BYOD, and what do you mean by BYOD is bring your own device. Instead of, hospitals, health agencies, patient care, clinicians, physicians, and health officials trying to be provided a mobile device that specifically addresses their mobile health apps. Bring your own device, use your smartphone, and we will have apps installed and securely made available and federally compliant for you to start using it. 85% of hospitals are embracing BYOD. I have some stats and some data from Case of Permanent Day that I will share later, a good case study. Physician tablet adoption for professional purposes has almost doubled, since 2011. and they've reached about 62% in 2012. And of course, with largest amount of tablets that are being sold, or iPads, iPads are being that ideal dominant mobile platform being used by physician professionals. 80% of the healthcare professionals out there say that, they use mobile devices to collect, store, transmit some form of protected health information. I was out there, at my physician's office, and my physician was collecting pretty much all the data, pertinent to me. He was, hooking up the blood pressure systems that was directly feeding, his iPad through Wi-Fi, and every single metric and health-related information that he gathered from my body was getting automatically transferred through Wi-Fi to his iPad. And the moment he clicked the prescribed medicines, those medicines directly got sent out, to a pharmacy, to a giant pharmacy out there in Ashburn. And when I went to the pharmacy, in the next 20 minutes, the pharmacy person out there was having a mobile device wherein she said, hey, yep, I already got an alert in my mobile device, and it's already getting processed. And the system, the moment she clicked, process it, it was directly sending that feed out to another tablet that somebody was carrying back out there in that store of inventory, and they were able to collect that and feed that back. It's unbelievable in terms of how the rapid growth of technology and the adoption of mobile devices is facilitating that ideal environment for mobile health to grow. At the same time, governance, compliance, regulations, and HIPAA, Health Insurance Portability and Accountability Act, is huge. A HIPAA violation can cost up to $1.5 million average in annual penalties. The healthcare data breaches, as data starts to flow through mobile devices, as mobile health becomes embraced more and more, the amount of breaches that are happening out there are also creeping up. They're up about 32% in the last 2 years. And it becomes extremely important, in fact, that's one of the themes for this webinar is, you have a roadmap, you want to go implement mobile health, but how do you successfully implement that without any risks, without any issues, without any of those, data breaches and penalties and compliance issues that can come down the road? How do you implement a very strong governance? And everything starts with defining your upfront requirements very clearly and understanding the challenges that are out there. So in today's webinar, that's exactly what I want to feed as food for thought. Some of the core objectives, I'm assuming we have some, representatives today from HHS and from FDA, out there on the webinar attending. Thanks some of the federal officials who found their time to make it to attend this webinar. I'm pretty confident and sure that you will gain some valuable insights at the end of this webinar, and I will provide my contact information at the end of this webinar, so you'll be more than glad to reach out to me and I can engage the appropriate SMEs if you further have any questions that I cannot cover in this 1 hour slot. But some of the core objectives, that are out there for health agencies and some federal agencies like the VHAs, like the military health systems, HHS, FDA, and I can go on and on. And of course, all the healthcare organizations, the physicians, the clinicians, the pharmacies that are out there, is from a mobile computing standpoint, you want to incorporate the power and possibilities of mobility into federal government efforts. The growth of broadband networks, the growth of rapid growth of mobile devices, the accessibility, the unbelievable power that the users are putting these mobile devices to use, the growth, the stupendous growth of mobile apps that are available out there, the hundreds and thousands of mobile apps, 97,000 mobile apps available related to health and fitness, and 4 million free downloads and 300,000 paid downloads that are happening related to mobile health are critical evidence that talk about the rapid growth in mobile health. You want to be able to build mobile technologies and services that can be reused, develop standard platforms, common governance models, mobile health strategy, which can help roll out mobile apps, through that platform, and be able to, focus on information sharing, share those common services amongst agencies, amongst public developers, with those healthcare organizations, the HMOs and the PPOs, as well as with the pharmacies, the hospitals, the clinicians, who are going, undertaking a lot of trials, out there. You want to be able to efficiently manage mobile and wireless acquisition, inventory, and the expenses associated with that, which again ties with BYOD, trying to reduce your total cost of implementing mobile health for larger agencies. You also want to be able to create a government-wide foundation to provide mobile health services and functionality that are needed in all agencies, specifically with focus on HHS, like ANIS, FDA, and military health systems that are out there. And you want to be able to foster collaboration. I already named all the stakeholders, amongst agencies, amongst the healthcare industries that are out there, the academias, the research that is going on, to be able to accelerate mobile health across government and be able to establish that governance structure for your federal mobile health needs. What are some of the challenges as you go about implementing mobile health? Well, security challenges, management challenges, and being able to support that are the top 3 challenges that are out there. From a security standpoint, well, you cannot afford to have lost devices or stolen devices, especially with PHI, your privacy information that are out there. How do you ensure ePHI, making sure that security of those ePHI that are residing in those mobile devices or allows connectivity to do that? How do you make sure that they are all cloud enabled? How do you make sure that they are secure? How do you make sure that you're able to remotely wipe? How do you make sure that your data resides in cloud and it's fetched only upon secure authentication? How do you make sure that the identity, the access management associated with mobile health data confined not only to the HIPAA regulations but also to the PHI compliance that is required? The HIPAA high-tech compliance, you don't want like jailbroken or rooted devices flying out there. Security challenges are huge, and I already told $1.5 million in penalties, for HIPAA violations. And the last thing that you want is to be, on the front pages of Washington Post or New York Times for a HIPAA violation, even though you could be a successful, mobile app success story. Management challenges, just lack of visibility. You want transparency with security, with compliance, for your mobile apps. You want to be able to provide that visibility, of the mobile apps, the simplicity associated with providing that, and be able to, address the lack of device identity. Now, it's like the chicken and the egg story. When you have federal health-related information stored in a personal device, and if the personal device gets lost, and you want to wipe off and prevent access to the personal device, now, the corporate data that is residing in the personal device, do you have access only to remove that, or can I override and be able to wipe off, personal information because the device has been compromised now from a security standpoint? Which comes first? Who owns the ultimate accountability and responsibility of corporate health-related data, federal health-related data residing in a personal device when you go BYOD? What kind of regulations, compliance, security challenges, and management challenges reside there when it comes to implementing successful BYOD? It's still an ongoing, challenge. Support challenges. Mobile health apps, they start providing real-time access, transparency, visibility, performance, and along with it comes a strong IT infrastructure backbone to be able to provide that real-time support, to be able to address the growing needs, the emerging needs when it comes to mobile apps, mobile security standards. These are implemented security requirements guide that defines for mobile app development to device management to all of it. How do you make sure that the DISA regulations are in compliance for applications for the 50+ applications that are currently being developed within Veterans Health Administration and the hundreds of mobile health applications that they plan to load into their mobile app store at VA. Device diversity. I mean, every day there are about 4 new devices that are being invented and sent out into the market. Growing needs. Should I embrace Android? Should I embrace the iOS? And how do you make sure that my mobile apps that I'm developing are not only web ready, but at the same time, from an IT support standpoint, they are able to address the various mobile platforms that are out there, and enforcing mobile use policies, which I already touched base. Moving on, a specific focus on the corporate versus VOD considerations from a mobile health standpoint. Corporate liability, when I say corporate here, I mean, it applies for the healthcare organizations from a corporate standpoint, the hospitals, the physician offices, the clinical institutions and the pharmacies out there, but also to the federal health agencies like the HHS, the NIH, FDA, and the military health systems, the BioMeds out there. You want to enforce strict mobile use standards when it comes to making your mobile health applications available out there. The high procurement costs, you want to bring it down, and you want to be able to have device training, as needed as you introduce, devices, and you don't want to introduce new devices. You want to use the personal devices that way around. You can eliminate the training costs, and there are slower technology reference costs. If I am providing corporate mobile devices, I want to get rid of that. That way around, the onus is now back on the individuals, for their personal devices to refresh, at the pace as is required from embracing the mobile health apps. Whereas when you look into the bring your own device on the right-hand side, it definitely provides minimal procurement costs. So if you want to implement a successful mobile health strategy at the lowest cost possible, VOD is the answer. But at the same time, you also are also getting the additional benefits of when the user is using his or her own device, productivity goes up significantly. And personal users are much more prone to the latest technology devices, the cutting-edge devices, than corporate providers because of the slower technology refresh cycle. And now you are able to embrace and address broad policy standards. What are some of the factors to consider in implementing successful healthcare mobile strategy? Of course, revenue, expense, and risk are the top 3 factors. From a revenue standpoint, yes, you definitely want to increase the number of services that are delivered out there, and you want to be able to launch new services, that address a whole variety of needs. At the same time, you want to be able to increase the patient satisfaction, that is out there. I'm going to give a classic example, out here from Kaiser Permanente. They have about 37 Kaiser Permanente hospitals which are paperless, and that's an opportunity to open the door for tremendous potential on how to care for patients, how to allow clinicians to practice the top of the licenses. And also, they have a lot of pilot projects, that are out there. Video conferencing has been out there for a long time. What they're trying to do is to convert this video chat, the conferences, being able to bring the healthcare professionals into mobile and, enhance more mobile capabilities. The patients, at the same time, also want and need to be engaged, at their terms. Technology tools, are playing a much bigger role here, to connect patients in a much more proactive, seamless, and service-oriented, way. And expense, increasing that caregiver efficiency, being able to, increase that efficiency, make it as close as possible to providing transparency, real-time access, secured access to patient health information, to, health information, health informatics, from hospitals, from physicians, being able to, pass it back to the clinicians as, patient health diagnostics and prescriptions are captured, being able to share that information back out to the pharmacies. By implementing mobile health, you're definitely reducing the cost of IT delivery, that are out there. What you're trying to do here is you're trying to converge those discrete applications, those discrete legacy systems. You're able to bring in an agency transformation by implementing, mobile health apps, and the cost associated with implementing a continuous delivery model when it comes to making upgrades to your applications, to your systems that are being deployed in a mobile, thanks to the cloud, thanks to the remote deployment capabilities that are out there with the increased use of Wi-Fi. They become so seamless that one of your healthcare professionals can have their critical mobile app updated on a nightly basis. He or she goes to sleep, next day morning he or she has the latest information. And big data is becoming more and more possible here, for healthcare professionals to even conduct analytics and predictive analytics, on larger amounts of data, being able to conduct sampling if needed. By transferring there's about 10%, in healthcare organizations that is considered administrative costs. Those costs associated with being able to enroll members, being able to process their, billings and the claim. That cost is huge amount of administrative costs. You are able to reduce those clerical errors, those billing errors for those healthcare organizations like healthcare, like United Healthcare and WellPoint and some of those, largest healthcare organizations out there. You can seamlessly reduce critical errors because health-related information, is becoming electronic health records, and being able to use mobile health to transfer those electronically is becoming more and more prevalent. Risk, being able to harness, bring your own device to speed adoption, and being able to manage the availability of PHIs that are out there and being able to deliver better information. These are some of the critical factors that you want to consider in implementing a successful mobile health strategy. For any strategy, requirements and some of the factors to consider from a requirement standpoint is very critical. And it starts with, 5 critical elements. Who are you developing a strategy for? Who are your stakeholders? The individual, the organizations, the strategy will address. Examples are, of course, your hospital staff, and you got to start thinking about using contract workers that are out there, and of course, the wider audience, the general public. What requirements, what capability sets are you trying to, develop? You take there's a person, who runs and tries to stay fit. And if you look into it, they can use like umpteen number of apps from those 97,000 apps. They use Map My Walk app. It is tied to their phone's GPS radio, and it accurately records their distance and pace. It's also a great motivator for them. At the same time, they also use another app, which is called the heart rate, that enlists their smartphone's camera, to record their pulse during their walks. There are about, and going back to this example, who is using it? What is their, intended, set of, capabilities that they are trying to access? I'm throwing a real-life example in terms of how an individual uses some of these apps to be able to capture their pulse rates, how their heart functions, how, well they're running, are they within that range, to keep themselves, from a fitness standpoint. Take the same example, going back to being able to tie, critical health organs, how they function, and being able to share that information out there, to those mobile devices, and being able to, set your own thresholds, and then, send alerts out there, at any given point of time, and being able to connect those doctors, who are on the road or who are off duty, but, need to address an emergency call, to the physicians, on duty, to the hospitals, to the systems within that hospitals that are being used, and be able to communicate back, to the patients, there in the hospital. And imagine that patient gets discharged, is out of the hospital, and he uses his mobile device still to be able to transmit critical information, back out to the doctor, and the doctor is, using applications at his end to do patient monitoring, remote patient monitoring, and an alert comes down with an anomaly, and the physician is able to communicate, mobile or, through alerts back to the patient to say, hey, it looks like your blood pressure completely went out of range. You got to be doing these things, come back. What are you doing? What physical activity, you're engaged in currently that is capturing it. You got to do these 4 things to get yourself back. You need to call first aid or be able to even automatically transmit information to emergency responses based on a person's health statistics gathered by a mobile device. I mean, that is where we are headed, in terms of the power of mobile health. Where, I gave the example, the physical location for the delivery of those capabilities. All hospitals, office locations, the individuals, pretty much globally anywhere. Why? The expected policy and the business outcomes associated with that. And improving, patient care, reducing the organizational risk associated with that. And how do you go about doing that? The mix of products, services. Are you going to make it both web-enabled or pure mobile? Or are you going to use mobile as a secondary medium? Or, what type of mobile devices are you going to be able to capture? Are these mobile devices going to be provided by the healthcare organizations and the federal agencies? Or are they going to be BYODs? And who all need to have this? The internal staff. What kind of an IT infrastructure? What kind of technology backbone? What kind of mobile application developers? What kind of mobile device and data management techniques and technologies that I need to implement? The backbones, the infrastructures, the network capacities, storage, all of those are extremely, extremely important. I cannot stop from bringing that example, of even a web-based, health-related deployment, the healthcare.gov, things gone wrong, with all the risks and being able to implement that. Time is of essence, but even more important than time is quality, when it comes to deploying mobile health. Moving on. Some of the best practices from a health mobility standpoint is, like I said, developing a mobile strategy and policy surrounding that and adhering to all the policies from like federal mobile standpoint as well as from a health regulation standpoint. Clearly define and communicate the policy to your end users. And when I say end users here, I mean all the stakeholders. It could be internal to your agency. It could be the healthcare organizations, the physician offices, the hospitals, the clinicians, the pharmacists that you're dealing with, and assessing the wireless network and overall infrastructure to make sure that the technology backbone exists for you to seamlessly deliver this. Because once you are tied to transferring and transmitting and collaborating critical health-related information when it comes to patients, when it comes to being able to transmit that information to the nurses and out there. I have a case study where WBB is currently assisting Veterans Health Administration in implementing some of the best requirements for their mobile app initiatives. And I'm going to cover a lot of those in that. But those things are very, very, very important. Even for a powerful web implementation like the healthcare.gov, it fails significantly, even though the web infrastructures have evolved over the last 15 years. When it comes to mobile technologies and being able to transmit critical health information and relying on that from a mobile technology standpoint, you would definitely want to have disaster recoveries, contingencies, securities, compliance, HIPAA regulations, and high-tech regulations in place. Determine that support structure. What is going to be that support structure? If nurses are going to rely on that, what are going to be the fallback options? If one nurse does not respond to a critical patient health information being transmitted, what time lag exists before that same information is passed on to, other nurses, who are not on duty, or, to the physicians who are on duty or not duty. A lot of that is very important. And again, MDM, mobile device management, is the foundation. What if the mobile device is not reachable, for the primary physicians? What if it is not in charge? How do you make sure that, you're capturing fallback? All of that, when it comes to implementing a mobile health strategy, it is not just associated with developing an application and deploying it, but, it deals with how it is put to use. Your requirements, your strategy needs to cover how well it is put to use, the usability of it, the reliability of it, is extremely, extremely important. Some of the stages here for a mobile, successful mobile health execution, like I said, just to summarize here is, planning the strategy, have a mobile roadmap, define your data and device policy, define how you're going to administrate the networks and the security aspects associated with that. Enabling it, the procurement, the acquisition strategies, surrounding that, dealing with the vendors, defining that evaluation criteria and defining the devices and having a procurement portal to be able to solicit the best-in-class service providers that are out there, and how well you're going to enable the deployment of those devices is very critical. From a controlling standpoint, you want to have centralized management, enabling cloud, enabling mobile device management, having expense and billing management centralized, and being able to control the real-time usage and performance monitoring aspects of it. What was the time it took for a nurse to respond to a mobile device, alert that she received? How well can that time be brought down? Did it take too long for us to send the alert? From the time the alert was originated to the time, it was read by the nurse, how long did it take? Did our push versus pull strategy work well? A lot of those questions have to be, answered. And it's the flow of events, and you have to control and centrally manage the entire flow of events as it relates to how hospitals, how health agencies are trying to address that. Having that right monitoring in place, very important, and being able to provide that support, end user support, at all levels. Health tech services, being able to train, configure, and being able to address changes, continuous integration, continuous delivery, agile delivery processes to be able to get your mobile apps updated, being able to identify anomalies and being able to implement a continuous process to upgrade and implement those incidents that happen out there in the field. How are you capturing the incidents, and how are you able to take the incidents and be able to loop that back into your process to bring those mobile health incidents down. And think kiosks, think customer services. One of the things that is huge is relying on the individual and empowering that individual with all related tools, diagnostics, and information on their mobile devices as it pertains to mobile health, so that the user is armed and prepared to manage his health or her health using the mobile device. And when it comes to being able to transmit information pertaining to, hey, these are some of the to-dos, these are some of the symptoms, this is some of the potential treatments, how do you make sure that the apps that are getting delivered and developed and delivered out there complying to the rules and regulations out there by FDAs and the NIH to make sure that they are not giving misleading information? Huge focus area. Empowering application development and management, being able to do custom application development, being able to have custom app stores like the VA mobile app store is a classic example, and being able to manage those mobile apps as I talked. Some of the four focus areas as it pertains to mobile health execution, that WBB is actively engaged in is on the acquisition support, trying to develop centralized acquisition vehicles for our clients and being able to develop and support the mobile acquisition strategy frameworks. We're doing that for one of our DHS clients as well as to our VA clients, and being able to do exactly and more than what I detailed here in the webinar from a strategy and policy support for mobile health, developing application strategies for mobile computing and being able to develop mobile data management processes and governance surrounding that. And more importantly, being able to provide that structural support. And what I mean by structural support is hey, there could be issues associated with broadband, accesses. There are issues associated with implementing these are security requirement guidelines or, any of the security architectures that are out there. And being able to establish common standards for this mobile health apps, being developed and being able to deploy. Governance, standards, and, process support. We are working with our clients on implementing POA ODs and being able to execute that and support it. Here is a case study that I want to really delve a little bit and talk about it. This is for one of our Veterans Health Administration clients. The VHA Office of Informatics and Analytics, they are in the process of collaborating with partners throughout PA to leverage technology and innovation in transforming the delivery of care for the veterans, their families, and caregivers. And what they want to do is they want to be able to implement and unify, integrated, and personalized virtual services. The personalized is very key there. And the virtual services, they want to be able to provide that through mobile devices. And that is the state-of-the-art system of care that they are trying to get to. And one of the goals is for them to implement mobile apps and mobile optimized websites. The websites that they are trying to develop, make sure that they are also mobile optimized to assist veterans and clinicians and be able to address whole range of health, management, and administrative needs. When it comes to veterans and their families, being able to check their benefits, look into the deductibles, see where things stand, where their claims are, when are they going to get paid, a huge backlog, that is out there, and then they want a very comprehensive mobile health strategy to be able to do that. And WBB is actually assisting Veterans Health Administration in conducting requirements analysis of each of their mobile app initiatives and be able to capture all the necessary business requirements, both functional and non-functional, requirements that ultimately support, various health fields within VHA, like radiology, pharmacy, nursing, what kind of care, details the nurses need, intensive care, occupational health, behavioral health, immunization administration. And our requirements that we are developing and working for the mobile applications to be developed and deployed, we are dealing with the upfront requirements, the acquisition strategy, to how they're going to get developed, tested, certified and accredited, and how they're going to get deployed. And we are also working with the vendors to make sure that we are capturing their business rules and at the same time addressing the federal health compliance aspects associated with that. As a result of this, I'm going to go through a bunch of those things. Like for the smart forms that are out there, we are developing templates on mobile devices. So veterans, their families, and the caregivers can go click on their mobile devices, and the standard forms are out there through the templates that we develop, wherein they can put progress notes against how their health is performing, or their home diagnostics for blood pressure and other critical data that they could do at home. Specifically targeting female veterans, information pertaining to women's health, women veterans' health, and information being transferred to them. We are working on requirements associated with that. We are also capturing what I call it as POCs, point of care activities for the nurses. Through the mobile devices, the nurses are able to feed in information as it pertains to clinical care interventions, and the actions that the nurses took, we are able to capture that so that we are able to conduct better quality assurance in the future. Of course, interactive patient care is another huge area wherein information as it pertains to educating the nurses on mobile devices, we're able to provide that. And occupational health, they're providing how to do safe patient handling in that area. And I can go on and on and on in terms of some of those. And because of WBB's efforts, in developing the requirements, this is going to result for VHA in accomplishing all of those things that I mentioned, just to name a few. Better requirements, help in successful healthcare roadmap strategy, and VHA is on the verge of getting all these mobile apps developed, tested, and deployed. They are in various stages into their mobile app store, and it's going to be giving a leapfrog jump, to the veterans, the caregivers, and their families, with that personalized virtual, care that they never had before. With that, these are some governance, policies moving on, and here are some of the shortlisted items, when it comes to, federal mobile computing. A much more, a detailed checklist of items here. It talks about, from an agency perspective, implementing, mobility innovation, center of excellence, within your agencies, VA, VHA, we're dealing actually with the Office of Innovation. They are definitely ahead, in some of these areas. Being able to establish and adhere to the federal mobility health infrastructure standards, and being able to develop those mobile applications based on your user needs, and at an agency level, being able to develop those policies, ensuring, of course, 508 compliance as well as the web compliances for those design and deployment of those web, mobile applications, both on web and mobile. Of course, I talked a little bit already on the BOE policies. One of the things that I definitely want to highlight, a very important aspect is that when it comes to mobile health, mHealth, one of our resident, subject matter experts, Satish, he's written mHealth leading, IT practices white paper. I strongly encourage, the participants to, go to our website at wbbinc.com and register yourself and be able to download that white paper and reach back to him or to any of our, health SMEs at WBB. It's a very interesting white paper. It talks a lot about, some of the IT practices in 5-6 different areas to implement a successful governance on mobile health. It talks a little bit more from an industry perspective, where the industry is headed, as a health agency, as one of those players in mobile health. How do you go about implementing a successful, IT practice? I definitely want to, encourage you download and read that white paper as well. And this webinar, I believe, is also going to be made available on our website. At this point of time, I'm going to open up for any questions that you may have. So I'm going to turn it back to Sophia.
All right, thank you for attending for WBB's webinar on mobile health, how to successfully execute your roadmap and manage your requirements. If you have additional questions, please reach out to Karthik through the information shown on the previous screen, or you can learn more about WBB through our website, and you can contact one of our health SMEs. Thank you. Have a great day.